Spinal stenosis is the narrowing of spaces within your spine, which can put pressure on the spinal cord and nerves. While often structural, systemic inflammation can dramatically amplify symptoms. Let's look at the primary mechanisms and how we approach these conditions clinically. Autoimmune inflammatory diseases cause the immune system to attack the body's own tissues. This leads to widespread inflammation, persistent stiffness, and chronic pain, which can complicate spinal health. Rheumatoid arthritis is a chronic inflammatory disorder that affects more than just joints. It poses specific risks to spinal health, facet joint integrity, and can directly impact nerve pathways. Ankylosing spondylitis is another chronic inflammatory arthritis. It primarily targets the spine and sacroiliac joints, often causing severe stiffness and nerve-like pain that mimics spinal stenosis. Systemic lupus erythematosus, or SLE, is a chronic autoimmune disease. It causes widespread inflammation that can affect various body systems, including joints, skin, and even vital organs. Psoriatic arthritis combines skin inflammation with joint and tendon pain. It can also actively affect the spine, frequently triggering intense, nerve-like symptoms. Vasculitis involves the inflammation of blood vessels. This condition can lead to pain, systemic fatigue, and potential tissue damage due to restricted blood flow to vital organs. It is important to understand why inflammation can feel like stenosis. Joint swelling narrows the pathways for nerve roots, often leading to radiating pain that mimics true spinal stenosis. Autoinflammatory disorders are distinct because the body triggers inflammatory responses without antibodies. The pathway is driven directly by the innate immune system. Gout often presents as localized joint inflammation. However, severe prolonged flares can breach local boundaries and trigger systemic inflammation, affecting overall well-being. Chronic recurrent multifocal osteomyelitis is a rare autoinflammatory bone disease. It is marked by sterile, non-infectious inflammatory lesions in multiple bones, requiring targeted anti-inflammatory therapy. Widespread joint and bone inflammation can closely mimic the distinct sensations of nerve compression, making it a diagnostic challenge that often requires detailed imaging. Connective tissue diseases involve systemic autoimmune and inflammatory disorders. They impact skin, muscle groups, tendons, and cartilage, leading to chronic pain and tissue degeneration. Scleroderma is a chronic connective tissue disorder characterized by gradual skin tightening and thickening. This can restrict joint mobility and generate persistent physical pain. Finally, myositis covers a group of rare inflammatory muscle diseases. They are characterized by progressive muscle weakness and localized immune responses, leading to soreness and damage. Mixed connective tissue disease is an overlap syndrome. It combines features of lupus, scleroderma, and polymyositis, representing a complex diagnostic challenge due to its multi-system nature. Patients often report that their pain feels like stenosis. Understanding this involves recognizing how muscular inflammation can physically mimic the sensation of spinal nerve compression. Central pain syndromes aren't primarily inflammatory, but they frequently coexist with chronic conditions. These syndromes alter how the nervous system processes pain signals. Fibromyalgia involves widespread pain and fatigue. It is often associated with, quote, brain fog and specific diagnostic criteria, setting it apart from purely structural spinal issues. Chronic widespread pain is driven by central nerve sensitization. In this state, normal sensory inputs can be amplified into persistent, diffuse pain throughout the body. Nerve sensitization is a mechanism where the central nervous system becomes hyperreactive, allowing the perception of nerve root blockages or pinching even in the absence of physical compression. Many patients struggle with coexisting conditions, where active inflammatory diseases and central nerve sensitization combine to produce significantly amplified systemic pain symptoms. Consulting a professional is essential if your symptoms are persistent or worsening. Clinical evaluation is the only way to accurately distinguish between mechanical stenosis and systemic pain. Clinical workups typically include blood markers for inflammation, metabolic screening, and advanced imaging of the spine to rule out true structural nerve root compression. Inflammation patterns are key to diagnosis. Localized spine issues often suggest mechanical nerve compression, whereas soft tissue or systemic joint involvement points to other inflammatory causes. Spinal inflammation affects vertebrae, discs, and ligaments. Because the spine has very tight anatomical spaces, even mild inflammation here can result in severe pain. Muscle inflammation presents differently, characterized by diffuse aching and fatigue, often impacting the thighs, hips, and shoulders more than the spine directly. Joint-specific inflammation like that found in arthritis involves swelling, warmth, and stiffness, often exhibiting symmetrical or asymmetrical patterns depending on the underlying cause. Determining the source of pain, whether structural, inflammatory, muscular, or a mix of these factors, is vital for effective, targeted management of your symptoms. Ultimately, systemic inflammation acts as a pain multiplier. Addressing the underlying inflammatory process is often just as critical as managing the structural elements of stenosis. Systemic inflammation causes immediate swelling in spinal structures, such as the ligamentum flavum, facet joints, and synovial tissue, which reduces the space available for nerves. This reduction in space directly amplifies symptoms by crowding the spinal canal, creating nerve pressure even without new bone growth. Inflammatory conditions, including rheumatoid arthritis and ankylosing spondylitis, specifically target spinal connections like facet and sacroiliac joints, worsening overall spinal stiffness. Reduced mobility from these inflamed joints forces the spine into rigid, unnatural positions that put further stress on already compressed nerve roots. Systemic inflammation also affects large muscle groups, leading to protective guarding and paraspinal spasms, which act like a clamp around the spine. This muscle tension reduces the space around nerves, turning mild stenosis into a significantly more symptomatic condition. Furthermore, fluid retention caused by inflammation can lead to edema around delicate nerve pathways, adding pressure that the rigid spinal canal cannot accommodate. Inflammatory cytokines can even alter central pain processing in the nervous system, potentially causing diffuse pain beyond the site of physical spinal compression. Chronic systemic inflammation also accelerates degenerative changes like disc loss and bone spur formation. Thank you for joining us in exploring these vital connections.